Good morning, Dr. K. He is a retired physician and also the organizer and founder of an organization called Health Watch USA. How are you this morning, Dr. K?
Doing very well, Jack.
Trust you had a good weekend.
Very good.
All right. Everything seems to lead to the Delta thing. As a matter of fact, an hour from now, we'll be talking to Simon Owen in London about that very thing, about what it's doing in other places other than the United States. But let's focus in on our country. It's a serious situation, right?
Well, it is, and it's starting to spike cases in a number of states. And I don't mean just drifting up, but I mean having another surge. And I think you can include Arkansas, Missouri, Florida, Louisiana, Alabama into that category. And that's not counting the whole plethora of states that are going upwards, and Kentucky's included in that. Our cases are rising, and as you know, our test positivity rate is now over 3% and going up.
And over 99% of the deaths, I understand, are from those not vaccinated.
That's correct. Last month, 99% of deaths are from those not vaccinated. From what we understand from Europe, about the same as holding with the Delta variant, that those dying are largely those who have not been vaccinated. So although the vaccine may not entirely prevent infections, it does give you good protection as far as preventing hospitalizations, and it looks like excellent protection on preventing death. Of course, we still want to avoid getting this disease because of long COVID, and we've been hearing more and more about that. But Jack, to me, it's very frustrating at this point that masks are not being worn by those who have not had a vaccine. And as far as I'm concerned, even if you're vaccinated, if you're going into an indoor, poorly ventilated setting, you should be wearing a mask. I think that's just key because, again, the data we're starting to see and the reports that we're seeing, there are breakthrough infections if you're vaccinated.
We have U.S. Senator Rand Paul with us as a guest. I think it's tomorrow or possibly Wednesday. I'll have to look at my list, but we've got him this week. Tell us what he's up to.
Well, the latest thing I have heard is on not wearing masks on airplanes. In other words, not having a federal mandate. And I strongly disagree with that. Airplanes and airports are areas where people congregate. You can easily spread the virus. The Delta variant can infect those that are vaccinated. Israel has shown that. There's also been a report at a gym out of Oklahoma where there have been a number of vaccine breakthroughs. So I think wearing a mask is key. And I should also add that airplanes are the one area where you have international travelers and people who could be bringing variants into the country. And there's a Lambda variant. There's other variants out there that you don't want to get either. So removal of masks in an airport setting is ill-advised. Everybody needs to wear those for everybody to be as safe as possible.
As always, a pleasure. We appreciate you being with us, and we'll talk to you on Friday.
All right. Thank you, Jack.
Dr. Kevin Kavanagh.